Okay, peace be to you all. This is Omar Abdul Malik, physician assistant and health educator. So I just got off my shift, so I want to go home, but I wanted to just give you guys some clinical pearls before I leave. And for those of you all who are either in PA school and approaching graduation, or for those of you all who are brand new graduates who have yet to begin your first job. And if you could remember this, one of these things, and that is that medicine is it's a service-oriented industry. It's very much a service-oriented industry, meaning that just like in higher education, where we increasingly, those of us who are involved in education, we have to cater to students as the consumer of our services, which is the education that we have to disseminate to the students. The clinician, we clinicians, have to cater to the needs and desires of the patient and their families. Now, this is within the parameters of ethics and the efficacious practice of medicine, of course. So, you can't let the patients and their families cajole you or even bully you into breaching ethics and forcing you to do things that you're not comfortable doing as the clinician. But you do have to show them that you appreciate their concerns. So there's three things that I've found have brought people into a healthcare setting. So that's what I call the three P's. So pain, paperwork, and appearance. If a person is in pain, they're going to come into the hospital, whether it's an ER or one of these minute clinics that are in department stores and so forth. If they need paperwork that has to be signed by a licensed clinician, usually an MD, PA, or an NP, they're going to come see you. If there's a change in their appearance, a market change in particular, they're going to come see you. They're going to make certain demands. Some of those demands are unreasonable. Others of those demands you can kind of work with the patient. But remember that it's very much a service-oriented industry. I have patients whose family members have just totally berated me. I've been on the receiving end of the frustration that families have, and they're demanding that I make my colleagues and I make their loved one better. I'm trying to tell them this person's got end-stage renal failure. They have CHF with an ejection fraction of less than 10%. They've got encephalopathy. They've got then they've got sepsis because they've got lines in them. They've got feeding dysfunction, so they're on G-tube. They're gonna break down eventually and get decubitus ulcers, no matter how much the techs turn them and clean them off. So they're like, well, how come this person's not getting better? I have to be patient. I've got to be the one that's got to call myself to a very high level of accountability in terms of keeping my proverbial cool and just kind of listening to that person and then explaining to them, the realities of their situation. Not that I don't believe in miracles. I am theistically inclined. But, sometimes you've got to give people, I ask people, do you want to get the 5-year-old talk or the 50-year-old talk? The 5-year-old talk is, don't worry, your mommy's going to be just fine. Because, a little kid's not going to really understand, the various intricacies of medicine, healthcare, and that we reach a point in our lives with these organic machines that we call our bodies. It reaches an ending point. A 50-year-old really should be able to understand that. Not that they necessarily accept it, but you've got to kind of understand. My wife is going to die. My parents are going to die. My wife's parents died. So this is part of life. This death that we reach. So I'm a hospitalist, so I deal with death a lot. I run codes, and as an aside, I'll tell you guys, it's really an awesome thing for me to be doing what I've seen people do on television shows like ER, Chicago Hope, you know, St. Elsewhere, and all these TV shows that I grew up watching. And now I'm the guy running the codes. Give me the epi and keep doing chest compressions, and all right, everybody clear, and we issue a shock if need be. But I'm the guy that's running the code, and it's a great experience, man. I'm loving this. I really enjoy what I do. Um, but I found that there's a great challenge in trying to meet the concerns of the patients and their family members. Sometimes we have to have a talk about death. Full code versus a modified DNR, do not resuscitate, or even addressing palliative care for certain patients, depending on where they are in their end stage of life. And this is the reality that we come through. It's not always an easy talk. I find that I have a particular knack for it. I think that's where I excel. There's other facets of my practice where I really need to work on, but I think I'm better than average. I'd say I don't want to toot my own proverbial horn, but I think I do. I've been told that I'm exceptional when it comes to patient interactions and patients' family interactions. That's I don't know. I'm fairly confident with that, but it's a challenge. There was a quote. It was one of the past, I guess, medical directors, and they said, "Your patients don't care how much you know until they know how much you care." So you really have to let them know that you care about them and their loved ones. You are caring about their concerns, and you want to listen to them. There's realities, but you're also there for them to a very large extent. We took vows to do no harm, and part of that doing no harm, I think, is to be a listening ear and try to heal as best you can with your spirit and your compassion. It ain't easy, but that's the job for which we signed up. So I hope you guys enjoy your sojourn as you study this awesome field called medicine in whatever capacity you're doing it. But I wish you guys the best of success in your positive endeavors, and invite you to subscribe to my channel if you so desire. And you can also reach me on Instagram, Facebook, Twitter, and LinkedIn. Take care. Peace.